Have you ever think of the foundation for good health, or the kind of living today and your children's future ways to survive life? Is it simply by drinking safe water, or having a fine shelter, and a table of good food? Look through the corners of your home, grasp towards your window, and take steps outside the doors to gaze along the nature. The farthest your eyes could reach to see are all part of what we call the environment, and it inextricably linked to the well-being of the individual. Its health influences human health as well, including our families, communities, and economies too. So what picture of a healthy environment we could dwell into? The environment in which people live their lives should be a place of cleanliness and good weather. And from all walks of life, a healthy environment can ensure the safety of their lives, not only physically but also mentally. By taking care of our environments, we take care of ourselves also. However, city living brings a range of challenges. Our activities continually distract our surroundings. When the health of environment comes to its near total deterioration, life expectancy comes to ruin and lots of physical and mental illness will rise. Life-threatening disease will increase and the quality of life is affected. The community then faces a difficult circumstance affecting economy. Therefore, give your best to learn and practice positive roles in maintaining a healthy environment. Let's work hand in hand to maintain our planet Earth and claim its positive impacts to our health and community. How a healthy environment impacts the health of the people and community. The positive impact of external space or the environment on people were well known long before our modern times. This module is to provide an overview of addressing the environmental features that affect human health and well-being towards a fine community. You will understand its positive impact and allow nature to remind you of survival and the quality of life we deserve to enjoy. A healthy environment includes our shelter, the air we breathe, our water, our food, and all other surroundings. It's the microorganisms, radioactive materials, and all other particles as well as the physical world that we have contact every day. Having a healthy environment is one of the major factors that lead to a productive and efficient learning process. This module will bring you to understand that the environment directly impacts human health. Social environment is a vital health support for individuals' day-to-day dealings with this external habitat. Wellness of the environment directly relates to the wellness and health of the entire human race and on every other species that make up balance on Earth. Many aspects of our environment, both built and natural environment, can impact on our health. It's important that we interpret health issues in the wider context of our environment and where we live. The environment's effect on our health is complicated, yet it brings good and quality living if the latter is being cared and protected. A healthy environment contains conditions that provide the means and opportunity to achieve physical and mental being. It also provides link to a sound economy. Therefore, environment has a direct impact to human health. From beach cleanups to mass tree planting to marches, individuals, communities, and governments have come out to stand shoulder to shoulder for our planet, advocated and acted for a healthy environment. Exposure to natural environments is associated with mental health benefits. Proximity to green space is associated with lower level of stress and reduced symptomology for depression and anxiety. Interacting with nature improves cognition for children with attention deficits and individuals with depression. Determinants of a healthy environment. Well-maintained homes. Well-paved streets and roads. Sanitary waterworks system. Clean and safe mini parks. Abundant trees and greeneries. Fresh air and clean natural waters. Proper waste and disposal system. And safe workplace. Actions towards a healthy environment and its health benefits. Healthy and sustainably plant our grown food stops the growing epidemics of obesity, diabetes, and other chronic illnesses related to poor nutrition, and supports local economies and farming practices that reduce harm to people and the environment. Activities directed to improve environmental health benefit such vulnerable populations of low-income and minority communities that are disproportionately affected by environmental hazards and inequity. Health programs that simultaneously strengthen access to healthy shelter, food, mobility, participation in decision-making, and connection to community. Reduce the risk of respiratory and cardiovascular diseases, obesity, diabetes, some kinds of cancer, and many other outcomes. Healthcare that reduces or eliminates the use of persistent bioaccumulative toxicants, carcinogens, and other high-hazard chemicals. People will practice primary prevention, helping to reduce the risk of cancer, developmental disabilities, and other chronic illnesses in our communities, and those up and downstream in the supply and disposal chains. Reduce use of mined metals, minerals, and fuels, and increase the proportion of sustainable renewable energy and materials. Benefit communities by making people practice primary prevention, creating green and healthy jobs, alleviating the adverse health effects of climate change, which results to decreased respiratory disease, prevent injury from severe weather events, stop infectious disease vectors, psychological trauma, and clean water shortages.